All right, Katie, you got your link shared out there. We're good. All right, good afternoon. Thank you for being here today with our weekly live Wednesday sessions. I'm Jessica Hayes. I'm the Work-Based Learning Coordinator with Alignment Rockford. With me today, I have Jennifer Benters. She is a master's in nursing with an advanced practice nurse, certified pediatric nurse practitioner. She's with Crusader Community Clinic at the Auburn campus. And I also have with me Katy Haun, who is our academy coach at Auburn High School. So Jen, we're just going to get started today by having you tell us a little bit about who you are, what you do, and how you got to where you are today.
Perfect. Well, thank you so much for having me. I'm excited to be here to talk to you guys all today. I am as Jessica said, I am the pediatric nurse practitioner that is the sole medical provider over at the Crusader Clinic school-based health center attached to Auburn High School. I have been here for 7 years now. I started with the inception of the school-based health center, and I've kind of been here for the entirety. I received my degree from the University of Illinois at Chicago, and I actually went to UIC in Chicago and lived in Chicago during that time. And then when I did my clinicals, where it's a time where you get your experience working in the field, I came back out to Rockford for my husband and for family. And so I did a bunch of my rotations, and I just loved Crusader and was able to get a job with them after I finished my rotation with them.
Is this something you always thought you wanted to do? Like, did you always want to be a nurse? You said you have nursing and education in your family. Can you tell us a little bit about how you got here? Like, was something you always wanted to do?
Sure. I didn't know what I wanted to do. So I went to my original undergrad degree. I have a bachelor's degree in biochemistry because I just had no idea what I wanted to do, but I knew I loved science. So I went to Drake University in Des Moines, Iowa. I thought I wanted to be a pharmacist. I thought I wanted to be a physician. I thought I wanted to be a researcher, but I talked too much. So I landed eventually with nurse practitioner after I was able to shadow some people. And so I truly, whenever I speak with students, like, I cannot express to you, if you have opportunities to shadow or just get to know the type of position, or, even if you know what field you want to go into, there's so many different positions within a certain field. Like in medicine, it's not just physicians, it's not just nurses. There's, these mid-level positions. Get the experience, because I would have never known this role unless I was given that opportunity. So senior year, I was able to shadow some people and figured out nurse practitioner was like the perfect meld of healthcare that I wanted to go into. I did a quick BSN program at UIC where I got my bachelor's in nursing in 18 months because I already had all the prerequisites. And then I worked as a nurse actually while I was finishing my master's, because I thought I found real value in making sure I had some kind of nursing experience. So I was a NICU nurse, which deals specifically with the tiny babies in the hospital that are born prematurely. And then, the rest is history. So.
And here you are today talking to me live on YouTube.
I like to say while I was kind of waiting to get into my nursing program, and I had my bachelor's degree, I had a whole fall that I was off because I didn't start my degree until January. So I actually was a long-term physics and chemistry sub for an entire fall semester. So my husband's a teacher, and I got to dabble in the teacher world for like 4 months. So I have a real appreciation for what educators do on a regular basis, because it is no joke. Well,
and then COVID,
and all that. No joke.
Yeah, and then COVID. I mean, this year has just completely flipped everything upside down.
Sure. Yeah. For all of us, right?
Yeah. Go ahead, Katy.
Just want to say that's really nice of you, but the angels here are all of you in healthcare. So thank you.
Thank you.
Yeah, it's been a rough year for you guys in the healthcare, and appreciate you still. I'm sure you've had plenty of sleepless nights and long days, and it's appreciative for all that you guys have done for our community and for our kids to stay here and do the best that you can for our community. We really appreciate that.
Oh, thank you. I appreciate hearing that.
Can you guys, I probably don't hear it enough. That's for sure.
Likewise, right? Yeah.
Can you tell us something like what excites you about going to work every day? What is one or a couple of things that make you excited about being a nurse, but also in the community nursing function that you have at Auburn High School?
So definitely, you never know what you're going to have each day. And I do appreciate that. I love walking in and knowing that each day is a new day and there are similarities with everything I do, but everything's going to be a little bit different. The patients that I'm working with, the diagnoses that I'm going to see, everything's going to be a little bit different. So I love that. It keeps things spicy because it's like, if I have a really rough day, I know tomorrow is not going to be the exact same day. So that really helps. I also have a really cool position. Like I work in healthcare, but I also am like an ancillary classroom for, a high school. And I round on the newborns at Swedish American Hospital for Crusader as well in the mornings before I come to the clinic. So like I have all these really cool niche roles that like I get to do that are just tailored to what I like. So I feel really fortunate because I know I'm lucky with my position. And yeah, I get to do all of these really fun things and it's different every day.
That's really cool that you get to do that, two different facets. You get to round in a hospital and then also be in the school setting. It really gives the students a perception of nursing, not just in a hospital, not just on a floor nursing. It really gives them perspective as an advanced practice nurse that there's a lot more to your job rather than just bedside nursing care. So those are the type of things we want to show our students and tell them what different opportunities and different career fields there are in nursing, not just, the typical what they see on floor nursing.
Yeah,
can you tell us about a project or something, maybe something you worked on, whether it's nursing school or currently a project that you worked on that has really been a lot of fun for you in your career?
I think honestly, and I hope this isn't a scapegoat, but the whole school-based health center, I mean, it is just to me. So for a little background for people that may not know,
I was just going to say, give us a little background on this because I don't really know what happens in the school-based center. So that would be great knowledge for all of us to really know what the background and how it works.
Absolutely. So I am the primary medical provider at the school-based health center, which means I function very similarly to a physician. I see patients for school physicals, sports physicals, well child checks, acute things, injuries. I diagnose, I treat, so I can prescribe medications, I can order lab tests, I can order diagnostic imaging, and kind of take care of the patient all within walking distance of the school nurse. And so typically when we have kids that come down from the school, they go to the school nurse first to make an appointment because, we need to keep track of kids. We just had the fire alarm pulled at Auburn a couple of days ago, and we need to know, like, there was a kid down in our clinic. We need to know where they're at during all issues. So you always have to go to the school nurse first and then get an appointment and come down and see us, and we take care of you. And so we also have dental services and optical services down here at the school-based health center. And truly, it's just kind of like a one-stop shop. We see newborns through 18, 19, depending. We want you to still be in school when you're here. So if you're 19 and still in school, we'll see you. And we help for a variety of things. Like I said, we do well child to ill visits to family planning. And so it's, for me, I just think it's such an awesome public health model because we have everything here. We have students and patients within arm's reach of us. If we need to follow up on something, we can actually get people here because a lot of the barriers like transportation they're not an issue. And so it feels, to me, it's been one of the greatest things for me to work through because it's just the perfect model for how we should be doing healthcare. And so, here's the deal is I keep having these like grandiose plans for the school-based health center. And then I like have a baby or a worldwide pandemic happens. And so I have these awesome plans and these projects, but it's like something like that happens. So, I always have plans to improve, like to open up more groups for mental health. So ADHD groups, groups for anxiety, depression. I have these really awesome plans for BMI count and exercise and nutrition counseling. I want to see a time when we can get a group of students together to work towards a good common cause. But that's not going to be something we're going to do immediately. So we're going to have to take a step back and see what the priorities for our school are and what we need to do to kind of help kids as they transition back to full-time classroom stuff. So.
Yeah, it's interesting to talk about what COVID's had, not just on learning, but on social emotional health. And, what can we do to really get these kids, now that they're back in person, getting them that social emotional help that they need, and helping with anxiety and things like that have happened during the pandemic. You look at it from an adult standpoint and from kids, but when I have a 10-year-old at home, and seeing what even he went through, remote learning for a while was tough. So it's trying to get him back into that swing of things. So it's got to be interesting, seeing a whole group of students coming back to the high school and getting them back to, back to being really excited about learning again. So, so can you tell me a little bit about you in the community, about your environment, your work environment? I'm assuming there are quite a few 5 of you that work together in the clinic. You said you work with the school nurse. Is more of what you do a team-based environment versus individually based?
Absolutely. I would say, and I'm sure somebody can think of an example, maybe pathology, but even so, I think everything in healthcare is team-based. Truly, the best type of healthcare is team-based. And so we're a small office. It's just myself. We have a front desk staff worker, 2 certified medical assistants, a mental health professional, a dentist with 2 dental assistants, and then an optometrist with 1 optical assistant. And so we are a small office, and it's been wonderful because my medical assistants have been with me for years. And so they know the inner workings of this, but they also have gotten to know the kids, and that's been really beneficial. So I don't know, for those of you guys out there, a certified medical assistant is a really cool position. It's usually a certificate, but it could be an associate's degree position, where you usually work with a provider, whether it be mid-level or physician, in an office setting. So similar to a CNA, but less in like a hospital or nursing home, and more in like a clinic setting. So I often like to tell people that, because that's another one of those positions that you just don't hear that much about, but it's such a cool way to break into healthcare, especially if you have an interest in outpatient medicine and stuff.
I think I would chime in on that.
Yeah.
So that brings up a really awesome point for a lot of our kiddos who are just really considering, like, do I really want to go for my bachelor's? That's a really good kind of stepping stone level. And then true or false, a lot of health systems, once you're in, will help assist for paying for that next step, should you decide you want to go for your bachelor's or even your master's.
So used to be more common, I think, with COVID, cost cutting and different things we've seen. Larger health systems certainly are still doing it. Crusader does not, but I see it as a huge stepping stone for a lot of people for their nursing degree. And it's a great way to it's a cost efficient way to get a degree, get into the workforce quickly, and really test out the waters to see if healthcare is the right thing for you.
Absolutely.
Yeah, absolutely.
We have two programs, Rockford Career College and Rasmussen in town. Both great programs too.
Well, and I think that's kind of brings up that conversation about career progression. There's different ways of looking at your career. You could go automatically for a year to a BSN program, or you could take this route and do a CMA program and walk your way through that career progression. So can you give us, it's a very broad topic, I guess, because you can take it different directions, but give us some that example of that career progression on next steps. I'm 16, 17, 18 years old. What do I do? Where do I go? What are my next steps?
Absolutely. Yeah. So like I was saying, I think getting a little bit of a shadow experience, if you know anybody, we can't, to be fair, we can't take anybody in the school-based health center for shadow experience because of HIPAA violations. And so HIPAA protects everybody's personal health information so that, somebody can't know somebody's business. So it's really important that we follow HIPAA, but unfortunately it does prevent us from being able to have people shadow us. But going back to that, I do think it's really important because there are lots of different areas in healthcare that you may not know about. So the CMA route is a really good one. Phlebotomy, so doing blood draws. Both of my CMAs do blood draws, but it is also just a position in and of itself. And so that if somebody was drawn towards that, that can also be a certificate or associate degree program too. Kind of a good way to break in to see if that's the right thing for you. But I think the CNA program that you guys at Auburn offer at the high school is such an awesome opportunity. And I really encourage people, if you're thinking of nursing, or even you really want to be a physician, physical therapist, all of this really gives you an opportunity to kind of see if working with patients, is for you, but also being in a field and working, you get to see all of those other roles. So even if you're thinking physical therapy, occupational therapy, those are all these, it's a really good opportunity to be a CNA. So I really encourage people to do that.
I originally went to school to be a nurse.
Okay.
I mentioned earlier, my sister's a nurse. So
Yep.
everybody was like, oh, you're just going to go to nursing school like your sister. We see how well that panned out. I obviously did not graduate with a nursing degree. And I think it's because, I mean, I worked as a CNA for a while, but I think I like the programs that we have because it really gives you an idea truly of what those different careers are. You know, when you think about healthcare, it's not just the patient care. There's so much else that goes into healthcare. Like you say, physical therapy, occupational therapy. I think those are things I might have been good at, but I didn't have the knowledge of those when I was younger. So I think it's really truly exploring those different careers that maybe nursing's not there for you, but there are other opportunities within healthcare that you can be successful at as well.
Absolutely. Absolutely. And it's just not like Grey's Anatomy. So it's good. It's good to know that getting into it.
Are you sure
It's not as
like
glamorous?
TV?
No, it's not.
I'm sure it's completely different, right?
Yeah, it is. It is.
What advice, Jen, would you give to what advice would you give to a student that's we talked about kind of what's the next steps, but what advice would you give to a student that's looking into going into healthcare?
So, just for students in general, and I like to say this to my patients too, you don't have to make your decision when you're 17. Really follow the path of something you like. I mean, I did not know exactly what I wanted to be when I grew up until I had graduated with a bachelor's degree. My husband is an educator. It took him 3 years after graduating with his bachelor's before he went back and got his education degree, because it's just, you don't know. And so I always encourage people to kind of just follow something that you like and give yourself as many experiences in life as possible to kind of try and figure that out, but also don't stop learning. It's really hard to get back into school once you just kind of stop and take a break. So whatever you choose to do, continue to push yourself, but don't feel bad if you don't know exactly what you want to do right now. So I know that's not healthcare specific, but I feel like, and then I contradict myself because these patients come into my office. I'm like, so what are you doing next year? Stop it. Stop asking that.
No, it's actually really good because we were doing a career awareness video at Rockford University, and the provost out there made a comment in his video that I love, that has stuck with me. He's like, be a lifelong learner. No matter what you do, no matter what career path you take, be able to be a lifelong learner. Always learn something, always ask questions, always get involved. He just, to me, that really stuck with me because it's true in everything you do. Just always be willing to be a lifelong learner. And I think that's kind of what you're saying in the same aspect of push yourself, continue to learn and continue to grow.
Yep, absolutely.
Great advice, John. And it's okay to ask people, like, you want aspirations, but don't have a meltdown if you don't know exactly what you want to do, like expose yourself, like you were saying, to different avenues and go from there.
Yeah, absolutely.
Awesome. Katy, do you see any questions or anything on your end?
I don't. I
Okay.
think YouTube might be getting a lot of the views. So if it's okay with you, Jen, if there's students after, I can maybe email you a list if there's questions.
Yeah, you bet. Absolutely.
Anything else you want to add, Jen?
No, but if you're at Auburn High School and you are interested, if you need an appointment or if you have any questions about things that we can maybe help you with or anything else, you can always come down and talk to us at the front desk, or you can always go to your school nurse and she'll be able to set you up with an appointment. And we just, we're just really excited to help students in any way they can. So if you have anything, just let us know.
I'd love to come take a tour and see it once the school opens up, if that's possible. Once I'm
Yeah.
allowed back in.
Yeah, come on over.
I
Absolutely.
would love to see it. I think it's a great concept. I think it's awesome. I think it's awesome what you do. And I think it's great that you talk to the students about different pathways that they can be in. And I think that's truly great.
Oh, well, thank you. And I appreciate Katie letting me be involved too. So thank you.
Thank you.
Thanks for all you do. You guys stay safe out there.
Thank you. You too.
Thank you.